Hi, I'm Darren Cabo-McCauley, DO, CEO and founder of Concierge Medical Cannabis. Today we're going to be having a discussion of cannabis and the brain, because the neuroprotective potential of cannabis has far-reaching effects on multiple disease states. Neurodegenerative disorders are caused by a slow and progressive destruction of one or many portions of the brain, or an over or underproduction of enzymes that affect brain function. The effects of the individual diseases depend on the portion of the brain that are affected. Included in this category are Alzheimer's disease, amyotrophic lateral sclerosis, multiple sclerosis, and Parkinson's disease. Approximately 50 million Americans are afflicted with this collective of diseases, and they have a cumulative economic cost of $1.5 trillion annually due to disability and the need for increasing levels of care, including decreased productivity in both patients and family members providing that care. Cannabis is used by patients suffering from neurodegenerative disorders to decrease anxiety, improve sleep, improve appetite, decrease pain, decrease muscle spasms, and as a sedative during periods of increased agitation. Difficulties with use include dosing problems when using tinctures and a lack of uniformity amongst agents used. Without a known way to prevent or treat most neurodegenerative disorders, the current standard of practice is decreasing symptoms as they arise. For example, in Parkinson's disease, movement disorders are treated by the administration of dopamine or its agonists. Acetylcholinesterase inhibitors are used to increase the amount of the neurotransmitter available to the brain and effectively help the brain to function, staving off confusion and decrease in memory in Alzheimer's patients. Neurodegenerative disorders are often accompanied by severe pain of nociceptive or neuropathic origin, which is treated with NSAIDs, invasive procedures, or even opioid medications. None of the available treatments reverse NDs, but they may function to improve quality of life by decreasing the symptoms and making patients more comfortable. In traumatic brain injury, or TBI, an insult to the brain causes a cascading response of inflammation, both vascular dilatation, which worsens bleeding, and vascular constriction, which starves tissue. Nerve excitation, which makes the ongoing tissue destruction a positive feedback loop, which can self-propagate after injury, is also possible. Early research shows that 2-AG moves to the site of injury after TBI and functions to decrease nerve excitation, modulate vascular tone, and decrease the release of local inflammatory cytokines. The effects have been so profound that it begs the question whether exogenous CBD or CBD analogs have a role in helping after TBI or a more insidious neurodegenerative disorder. Taking clues from the ECS, or endocannabinoid system, further exploration demonstrates the effects of CBD on the brain and leads to the rationale for testing in other NDs. Animal models show that CBD has significant neuroprotective effect by decreasing inflammation, functioning as an antioxidant, and by exerting anti-apoptotic effects, programmed cell death. Remarkably, CBD has also been shown to decrease tau protein neurofibrillation, the root cause of the plaques seen in Alzheimer's disease. Current treatment in amyotrophic lateral sclerosis, or ALS, consists of a vast array of agents, all acting through different mechanisms, including anti-inflammatories, tumor necrosis factor inhibitors, glutamate antagonists, and mitochondrial function enhancers. These mechanisms of action should all sound familiar. Cannabis acts on all of the above components. Epilepsy is a disease characterized by unprovoked electrical activity leading to seizures, which can consist of losses of awareness, consciousness, or tonic-clonic jerking. The cause for epilepsy is currently unknown. Available treatments are only effective in approximately 2/3 of patients, leaving many patients with significant morbidity and mortality. Even patients that do get relief from current medications face a wide range of side effects, including sedation, weight gain, changes in the teeth, skin, or nails, tremors, and destruction of the liver and bone marrow. Both animal and human trials have demonstrated the efficacy in treating epilepsy by decreasing seizures and subsequently improving quality of life in patients with intractable seizures through the use of medicinal cannabis. In 2020, the FDA approved Epidiolex, a highly purified CBD oil for the treatment of intractable seizure disorder. Efficacy has been demonstrated for high-dose CBD in the reduction of seizures in both children and adults, with the main adverse events being nausea, vomiting, and sedation. The decrease in seizures that's been demonstrated has been shown through multiple trials and with relatively few side effects. However, in addition to a reduction in the number and duration of seizures, patients were often provided with significant symptom relief as well. This included improvements in sleep, less disruptive behavior, improved communication, improved awareness and alertness, and progress with motor skills. Caregivers of children with seizure disorders treated with cannabis have expressed satisfaction with treatment and noted improvements in their children. Seizure disorder is among the oldest uses for medicinal cannabinoids. Class 1 evidence has shown their efficacy. Multiple studies have demonstrated and tracked the side effect profile. However, the precise mechanisms of CBD's effect on epileptic patients remains unknown. CBD binds to the CB2 receptor, but it has many other effects, including various other receptors stimulated. The effects of CBD on seizure remain an enigma. A common thread with dosage of medicinal cannabis is an attempt to identify both components and mechanisms of action that can be replicated. There is value in this approach. However, the desire to separate cannabis into components negates the entourage effect that cannabinoids and terpenes have when they interact together, as they can both mitigate side effects and enhance their effects together in smaller doses. I'm Dr. Darren Cabo-McCauley, CEO and founder of Concierge Medical Cannabis. Thank you for joining me in this discussion today of cannabis in the brain. We hope to see you again soon.